All right, I am here in Indianapolis, Indiana, and check out where I'm at. So my son gets to check off another NBA stadium off of his list, and what I have noticed that is very unique about the team store in this stadium is that it is the most evenly divided between NBA and WNBA teams. And a lot of the stadiums that we've been to, not as much attention is given to the WNBA teams, but here in Indiana, I mean, it's WNBA season, and there is a ton of stuff. It helps that Caitlin Clark is the most popular basketball player from a WNBA perspective right now. But very good job, Indiana. But you're not here for that. You're here to learn how Medicare works in Indiana. So let's talk about it. Indiana, you are very standard in the sense that you comply with all of the national rules. You don't have anything unique or different in following the rules of Medicare that the national rules would be. So this is our 37th state so far on this road trip, and we are coming off a bunch of states that had a bunch of different weird exceptions to it. Indiana, you're kind of back on track to being standard. So a lot of the videos on our channel talk about general concepts and general ideas about Medicare. And so if you watch any of those videos and you're in Indiana, a lot of those concepts are going to apply to you. You aren't going to have a lot of exceptions. So let's start with the supplement plan side of things. If a 65-year-old were looking for a supplement plan G, nationally, the average would be $150 per month. Here in Indiana, you are at $125 per month as the national average, so considerably lower than the national average when it comes to your G premiums. Supplement plan N's average is $120 per month for a 65-year-old. Here in Indiana, you're at $95. So for sub $100 a month, you're getting a supplement plan N. So I guess that's what makes you exceptional, is you have very low rates for plan G and plan N. These are averages, so there are plans that are higher, there are plans that are lower. And in addition to these already really low rates, there are opportunities to find even more discounts. So for example, there's a discount if you have somebody in the same household that is on a supplement plan with you. So for example, if me and my spouse are both on supplement plans with the same insurance company, there are insurance companies that will say, hey, because you're both with us, we'll give you a discount. There's a discount called a wearable discount. If you're willing to wear a smart watch like an iPhone or a Fitbit or a smart tracker and connect that with the insurance company, they will give you a discount because they know that you're active and exercising. There are discounts if you're willing to pay your premiums all up front for the year rather than month to month. So there are a lot of opportunities here to get even lower rates, and there are insurance companies that will allow you to stack these discounts on top of each other. So if you qualify for multiple, you can get even lower rates. This is why I'm always advocating that you use an independent licensed agent who's familiar with your area, so that not only are you getting plans that have low rates that fit within your budget, but also you're finding even more discounts, and they're putting you with a creditable insurance company where the rate increases will be normal and stable. I'm not even saying you need to use us, use our competitors, just use a licensed agent. It is never going to cost you anything to use an agent. They'll be able to help you all with all of this. And I mentioned carriers that will have stable increases. The reason that gets really important here is that you are an attained age state. What that means is that supplement plans are based on the age that you have attained. Now, I'll explain that a little bit. There are three ways that supplement plans are traditionally rated. So the first would be community rated. That's where your age doesn't matter. A 65-year-old is paying the same as a 105-year-old. There's issue age, and that's going to be based on when you are issued the policy for the first time. So if I go on at 67, it's a little bit higher than if I were to go on Medicare at 65 in a supplement plan. And then there's attained age, and this is going to be based on the age that you attain and is ongoing. So all three of these plans have annual increases. They will all have an increase that is based on rising healthcare costs, inflation, and how that insurance company is performing. But attained age plans can have a second increase, and that is because when you attain a new age on your birthday, we sarcastically refer to this as a happy birthday increase. So you could also get an increase on your birthday. When you go from 65 to 66, you've attained a new age, and you can see a little bit of a bump, and that can happen every year. So up to 2 increases can happen with attained age plans. So that's why they traditionally start lower than the others, which we see here in Indiana. You're well below the national average for a 65-year-old, and then as you age up, those increases start to catch up with the other ones in many cases. Now, the supplement plan penetration rate is something that we look at here. How many people are picking supplement plans as opposed to other things like Advantage plans or something else? And the national average is 21%. Here in Indiana, it is 28%. And that's only a 7% difference, but that's one of the higher supplement plan penetration rates out there. You have more people choosing supplement plans, and that's not me advocating that you do or do not look at supplement plans. Those are just the numbers that we see here in Indiana. Your rules around switching supplement plans are the same national rules, and what that means is that if I want to switch from one supplement plan to another, I'm on a supplement plan, we'll talk about Advantage here in a minute, but I'm on a supplement plan, and I want to switch to a different one, whether that's down within the same insurance company or whether that's from one plan G to another plan G with a different insurance company, you would need to go through medical underwriting. That means you're going to answer medical questions. If your health is good, then there's really no problem here. If your health is poor, depending on how poor, you could see higher rates than normal, or you could be flat out denied. So that's something to consider here. Switching supplement plans gets a little bit tricky. Again, this is the same nationally. There are just some states that have different, more flexibility around this. All right, let's move over to the Advantage plan side of this conversation. Now, the maximum out of pocket is a big number that we look at when we're talking about Advantage plans. The average nationally for a maximum out of pocket is $5,000 for the year. Once you meet that mark, then the insurance company will take care of 100% of the costs that are approved above that number. Here in Indiana, the average is $4,000 per year. So your average is lower than the national average, which is a good thing. And again, this is an average. You will find plans that are higher and plans that are lower. The Advantage plan penetration rate nationally is 50%. Here in Indiana, it is 48%. So you're a little bit lower than the national average, but pretty close. And as is the case with most states and Advantage plans, where you live matters, and so they are zip code dependent. In general, in larger cities and around more urban populations, you're going to have more access to Advantage plans because there's more insurance companies who are trying to compete here, and so they're going to strengthen their plans a little bit. As you get more rural, you will have fewer Advantage plans to pick from. Their benefits might not be as strong as what you would find in a bigger city, or you might not have access to any Advantage plans if you're rural enough. So just keep that in mind on the Advantage plan. Again, a reason to use an agent to help shop around and see what's available for you. Now, switching from an Advantage plan to a supplement plan, let's talk about that. We talked about supplement to supplement. Now let's talk about Advantage to supplement. It follows the same national rules here. So there are 4 things to talk about. The first 2 would be trial rights. Trial right number 1 is if you go on Medicare at your 65th birthday. It's important that it has to be your 65th birthday. After that, this won't apply. So at your 65th birthday, you go on Medicare and you pick an Advantage plan. If this is the case, you have a 12-month window where you can switch back to original Medicare and a supplement plan if you want, with no medical underwriting, no fear of getting denied. The second trial right is if you go on Medicare at any age. So it doesn't have to be at your 65th birthday now. It's at any age, and your first choice is a supplement plan. In this event, if in the future you want to switch and try out an Advantage plan, you can switch off the supplement plan onto an Advantage plan, and then you have a 12-month window where you can try it out. And then at any time within those 12 months, if you want to go back to original Medicare and your supplement plan, you can, with no medical underwriting. So those 2 are the easy switches. The other easy switch would be what's called the special election period. The most common is if you move outside of your coverage area. There are others, but the most common is you're moving outside of your coverage area. In this instance, you would be able to switch back to original Medicare and a supplement plan without any medical underwriting, or if you are enjoying an Advantage plan and you move out of your coverage area, you could pick up another Advantage plan. So those are the 3 easy ways to switch. The 4th way to switch from Advantage to supplement plan would be going through medical underwriting. So you can do that. You can try to switch back to original Medicare and a supplement plan. You'd have to go through medical underwriting, and then you need a qualifying event to move back onto original Medicare. This would come during the annual enrollment period, which is October to December, and any changes during that time go into effect on January 1st. That could be during the open enrollment period, which is January through the end of March of every year, or that could be one of those special election periods. So you're going to want to time that to where you're switching back onto original Medicare at the right time, because an Advantage plan comes with a Part D prescription drug plan. And if you're switching off of an Advantage plan that has one of those onto a supplement plan in original Medicare, you're going to need to pick up a standalone Part D drug plan, and you can only do that during certain windows. So timing of all this is important. Again, use an agent, even if it's not us. I do have partners who are licensed and familiar with the plans here in Indiana, and we'd be more than happy to help. My email's in the description of this video, or you can go to theretirementnurse.com and we'd be happy to help. But again, even if it's not us, just use an agent. It won't cost you anything. All right, I like to leave secret words at the end of all of these videos just to make sure you've made it this far. And if you leave the secret word in the comments, then I can take those comments a little bit more seriously, because I know you've made it to the end. So the secret keyword here, again, your WNBA fans and the support here in Indiana is much different than anywhere we've seen so far in the country. So if you comment with Caitlin Clark's name or her number, which is number 22, which happens to be my number in high school, then I'll know that you've made it this far, and that'll be our little secret. If you haven't subscribed already, please do so. It helps more than you know. My family and I are going to go explore a little bit more. Thank you for making it this far. I will see you in the next video.